Welcome to Module 4, Navigating the Maze of Dementia. This module dives into the multifaceted journey of dementia, a condition affecting millions worldwide. Together, we'll explore its challenges and complexities, uncovering insights to improve understanding, empathy, and care. Whether you're a caregiver, professional, or simply curious, this module is designed to deepen your knowledge and equip you with practical strategies for navigating dementia's impact. Normal aging brings gradual changes in memory, understanding, concentration, and the ability to learn new tasks, often accompanied by occasional forgetfulness. These changes are a natural part of the aging process and differ significantly from the more profound and progressive cognitive decline associated with dementia, which impacts daily functioning and quality of life. Recognizing this distinction is essential for understanding and addressing cognitive health in older adults. Mild cognitive impairment, MCI, involves noticeable changes in memory and thinking skills that go beyond normal aging, but do not significantly interfere with daily life. It's an important stage to recognize and monitor, as it may increase the risk of progressing to dementia. Early identification of MCI provides an opportunity for intervention, lifestyle adjustments, and planning to support cognitive health and overall well-being. Recognizing when to seek medical advice is essential. Contact a doctor if you notice disruptions in daily life, challenges with problem-solving, confusion about time or place, trouble with language, poor judgment, or significant mood and behavior changes. Early intervention can help identify potential causes and provide appropriate care to manage symptoms effectively. Dementia is an umbrella term for a significant decline in cognitive abilities that interferes with daily life. It affects memory, thinking, and behavior and is not a normal part of aging. Dementia requires early recognition, attention, and proper management to improve quality of life and provide necessary support for those affected and their caregivers.
Dementia is a general term that describes the loss of the ability to think, remember, and reason. People with dementia have difficulty completing everyday activities, and symptoms worsen over time. Dementia happens when nerve cells in the brain stop working properly. There are many types of dementia. Some types include Alzheimer's disease, frontotemporal dementia, Lewy body dementia, and vascular dementia. Some people may have changes in their brain caused by more than one type of dementia. The risk of developing dementia increases as individuals grow older. Most people with dementia are age 65 or older, and research shows that about 1 in 3 people age 85 or older in the United States may have some form of dementia. Still, dementia is not a normal part of aging. Not everyone develops it as they grow older. Scientists are working to discover why some individuals develop dementia and others don't. While healthy lifestyle approaches, such as regular exercise, may help some people reduce their risk of developing dementia, more research is needed. Dementia can cause problems with thinking, memory, and behavior. Some people may also have trouble controlling their emotions and may experience changes in their personality and movements. Symptoms can vary depending on the type of dementia, but common signs include difficulty understanding or expressing thoughts, memory loss and confusion, getting lost in a familiar place, trouble handling money, or losing balance. However, these symptoms don't always mean someone has dementia. Dementia-like symptoms may be caused by depression, side effects from medication, vitamin deficiencies, or other medical conditions. Talk with your doctor if you have concerns about your ability to clearly think, learn, or remember, or if you notice changes in your personality or movements. Doctors can help determine whether your symptoms are caused by dementia or another health condition. If you do have dementia, obtaining an early and accurate diagnosis can help you manage the disease through potential treatment options and help you plan for the future. Learn more at alzheimers.gov.
Some causes of dementia are reversible, making early detection crucial. Conditions like medication side effects, thyroid disorders such as hypothyroidism, severe depression, and infections like urinary tract infections or pneumonia can mimic dementia symptoms. Identifying and treating these underlying issues can significantly improve cognitive function and overall well-being. Irreversible causes of dementia result from conditions that cause permanent brain damage, such as Alzheimer's disease, vascular dementia, and Lewy body dementia. Recognizing these causes is essential for setting realistic expectations, planning long-term care, and focusing on strategies to enhance quality of life and provide meaningful support for individuals and their caregivers. Alzheimer's disease progressively damages the brain, starting with memory-related areas and eventually affecting other cognitive and physical functions. It involves the buildup of plaques and tangles, loss of brain cells, and shrinking of brain tissue. Understanding these changes is essential for advancing treatments, improving care strategies, and supporting those affected by the disease.
In healthy people, all sensations, movements, thoughts, memories, and feelings are the result of signals that pass through billions of nerve cells or neurons in the brain. Neurons constantly communicate with each other through electrical charges that travel down axons, causing the release of chemicals across tiny gaps to neighboring neurons. Other cells in the brain, such as astrocytes and microglia, clear away debris and help keep neurons healthy. In a person with Alzheimer's disease, the most basic form of dementia, toxic changes in the brain destroy this healthy balance. These changes may occur years, even decades, before the first signs of dementia. Researchers believe that this process involves two proteins, called beta amyloid and tau, which somehow become toxic to the brain. It appears that abnormal tau accumulates, eventually forming tangles inside neurons. And beta amyloid clumps into plaques, which slowly build up between neurons. As the level of amyloid reaches a tipping point, there is a rapid spread of tau throughout the brain. But tau and beta amyloid may not be the only factors involved in Alzheimer's. Other changes that affect the brain may also play a role over time. The vascular system may fail to deliver sufficient blood and nutrients to the brain. The brain may lack the glucose needed to power its activity. Chronic inflammation sets in as microglial cells fail to clear away debris, and astrocytes react to distressed microglia. Eventually, neurons lose their ability to communicate. As neurons die, the brain shrinks, beginning in the hippocampus, a part of the brain important to learning and memory. People may begin to experience memory loss, impaired decision-making, and language problems. As more neurons die throughout the brain, a person with Alzheimer's gradually loses the ability to think, remember, make decisions, and function independently. Achieving a deeper understanding of the molecular and cellular mechanisms and how they may interact is vital to the development of effective therapies. Much progress has been made in identifying various underlying factors. Advances in brain imaging allow us to see the course of plaques and tangles in the living brain. Blood and fluid biomarkers are providing insights about when the disease starts and how it progresses. More is also known about the genetic underpinnings of the disease and how they can affect particular biological pathways. These advances enable the development and testing of promising new therapies, including drugs that reduce or clear the increase of tau and amyloid proteins in the brain, therapies targeting the vascular system, glucose metabolism, and inflammation, and lifestyle interventions like exercise or diet, and behavioral approaches like social engagement that may enhance brain health. Research is moving quickly, ever closer to the day when we can delay or even prevent the devastation of dementia.
Alzheimer's disease is the most common form of dementia, characterized by progressive memory loss, cognitive decline, and changes in behavior and personality. As the disease advances, it impacts daily functioning, requiring comprehensive care and support. Early diagnosis and the tailored care plan are essential for managing symptoms, providing quality of life, and assisting both individuals with Alzheimer's and their caregivers through the disease's challenges. Alzheimer's disease progresses gradually, with symptoms worsening over time, including increased memory loss, confusion, and difficulty with daily tasks. Early detection is key to managing the disease, as it allows for timely interventions that can slow progression, improve quality of life, and provide support for both individuals affected and their caregivers. A proactive approach helps in adapting care plans and maintaining independence as much as possible. In the early stages of Alzheimer's disease, symptoms often include forgetfulness, confusion about time and place, changes in personality, noticeable shifts in appearance, and poor judgment. These early signs can be subtle, but recognizing them is crucial for effective management. Early diagnosis allows for interventions that may help slow disease progression, improve quality of life, and provide individuals and caregivers with the support and resources needed to navigate the challenges ahead. In the middle stages of Alzheimer's, individuals may struggle to recognize family, have difficulty finding words, experience emotional outbursts, and wander. They also require more assistance with daily tasks, such as dressing, eating, and bathing. As cognitive and functional abilities decline, a tailored care plan becomes essential to ensure safety, provide support, and maintain quality of life for both those affected and their caregivers. In the late stages of Alzheimer's, cognitive decline becomes severe and individuals require help with basic tasks like eating, dressing, and bathing. Behavioral changes may intensify with increased wandering and confusion. As independence decreases, individuals become highly dependent on caregivers for daily support. At this stage, a focus on comfort, safety, and emotional well-being is crucial for enhancing quality of life. Parkinson's disease dementia, PDD, results from nerve cell damage in the brain, affecting both movement and cognition. Symptoms include tremors, stiffness, balance issues, memory loss, and confusion. Recognizing these signs is key to providing the right care and support, helping manage both motor and cognitive challenges, and improving the quality of life for those affected and their caregivers. Vascular dementia is caused by reduced blood flow to the brain, often due to stroke or other blood vessel issues. This impaired circulation can lead to cognitive decline, including memory problems, confusion, and difficulty with decision-making. Effective management focuses on maintaining cardiovascular health through medication, lifestyle changes, and regular monitoring, which can help slow the progression of symptoms and improve quality of life for those affected.
Vascular dementia is a common type of dementia that can result when blood flow to the brain is disrupted. It can occur when certain conditions such as stroke damage the brain's blood vessels and interrupt the flow of blood and oxygen to the brain. high blood pressure, diabetes, and high cholesterol can all increase a person's risk of developing vascular dementia. Symptoms of vascular dementia can begin gradually or appear suddenly and may worsen over time. These may include problems with thinking and memory, changes in behavior and mood, and disrupted sleep patterns. Not everyone with vascular dementia experiences the same symptoms, which may vary depending on the size, location, and number of damaged areas in the brain. Problems with thinking and memory are common in people with vascular dementia. They may have trouble reading, writing, or finding the right word when speaking. They may also find it difficult to perform tasks that used to be easy, such as tying shoes, and may have trouble following instructions or learning something new. People with vascular dementia may also experience changes in behavior and mood. For example, they may lose interest in activities they used to enjoy, become depressed or angry, or seem unaware of dangerous situations. Some people experience hallucinations or delusions, believing something is real that is not. People with vascular dementia may also experience changes in sleep patterns, such as disrupted sleep at night or excessive daytime sleepiness. If you or a loved one is concerned about thinking and memory problems, changes in behavior and mood, or unusual sleep patterns, talk with a doctor. To figure out if vascular dementia is the cause of these symptoms, a doctor may review the person's medical history and lifestyle, conduct memory or thinking tests, and order a brain scan. Treatment for vascular dementia focuses on preventing further damage to blood vessels in the brain. Certain medications and lifestyle changes may help. Your doctor may recommend managing high blood pressure, eating well, limiting alcohol, not smoking, and being physically active. People with and without vascular dementia may also be able to join clinical studies where they can help scientists learn how to prevent and treat this disease. Through participating in research, volunteers may build their support network, access new treatments or tests, and receive expert medical care. To learn more about vascular dementia, visit alzheimers.gov/vascular-dementia.
Frontotemporal dementia, FTD, causes progressive damage to the frontal and temporal lobes of the brain, affecting personality, behavior, and language. Symptoms may include changes in behavior, such as impulsivity or social withdrawal, along with difficulties in speech and communication. Early recognition and support are key to managing symptoms and helping individuals and families navigate the challenges of this condition.
Frontotemporal dementia, or FTD, is a rare form of dementia that tends to occur at a younger age than other forms of dementia. About 60% of people with FTD are diagnosed between the ages of 45 and 64. FTD and related disorders gradually damage the brain's frontal and temporal lobes. The frontal and temporal lobes in the brain are involved in behavior, movement, language, and emotion. In FTD, nerve cells in these lobes stop working properly. Symptoms of FTD vary from person to person and may include changes in personality and behavior, difficulty moving, and trouble communicating. As the disease progresses, symptoms get worse and new symptoms may appear. The three main types of frontotemporal disorders are behavioral variant frontotemporal dementia, FTD-related movement disorders, and primary progressive aphasia. Behavioral variant FTD causes changes in personality, behavior, and judgment. A person may have problems doing tasks with multiple steps and may become frustrated, act inappropriately, or become disinterested in people and activities they used to care about. People with movement disorders related to FTD may walk more slowly or stiffly, have shaky hands, or be unable to make common motions, such as using a fork. Primary progressive aphasia is a type of frontotemporal disorder that makes it difficult to use language. A person may lose their ability to speak, read, write, or understand what others are saying. Scientists are still studying what causes FTD People with the disease have abnormal amounts of tau and TDP43 proteins inside nerve cells in their brain. In most cases, the cause of this buildup is unknown. However, changes in genes may also lead to FTD. People with a family history of FTD are more likely to have a genetic form of the disease. FTD can be hard to diagnose because symptoms are similar to other conditions. If you have a family history of FTD or are experiencing changes in personality, behavior, or movement, talk with a doctor. While there is no cure, there may be ways to help manage the symptoms. To learn more about frontotemporal dementia, visit alzheimers.gov/FTD.
Lewy body dementia is caused by abnormal protein deposits, known as Lewy bodies, in the brain. These deposits disrupt cognitive function, movement, and can lead to symptoms like memory loss, confusion, tremors, muscle rigidity, and hallucinations. Managing Lewy body dementia requires a comprehensive approach to address both cognitive and motor symptoms, ensuring the best quality of life for individuals and providing support for caregivers.
Lewy body dementia, or LBD, is a brain disorder that can cause problems with thinking, movement, mood, and behavior. In LBD, abnormal clumps of a protein called alpha-synuclein accumulate in brain cells. These clumps are called Lewy bodies. They cause brain cells to stop working correctly and eventually die. What causes these changes in the brain is not yet fully understood. While LBD typically begins at age 50 or older, sometimes younger people may develop the disease. LBD is a progressive disease, meaning symptoms start slowly and worsen over time. LBD symptoms vary widely from person to person, but often include changes in memory, thinking, mood, behavior, sleep, and movement. Common thinking-related symptoms of LBD include unpredictable changes in concentration or alertness, trouble multitasking and problem-solving, problems with visual and spatial abilities, such as judging distance and depth or misidentifying objects, and seeing, hearing, or smelling things that are not there. Memory problems are also common, but may not be noticeable early on. LBD can also cause changes in mood and behavior. These changes may include depression, a lack of interest in normal daily activities or events, anxiety, agitation, and restlessness. Sleep-related symptoms of LBD may include acting out dreams while asleep, sleeping too much or too little, and certain sleep disorders. Some people with LBD develop movement problems. Symptoms can include tremors or shaking, muscle stiffness, and balance or coordination problems. If you are experiencing changes in your thinking, movement, sleep, behavior, or mood, talk with a doctor who can help you figure out if you have LBD. There are two main forms of LBD: dementia with Lewy bodies and Parkinson's disease dementia. In dementia with Lewy bodies, people have a decline in their thinking skills that may be difficult to diagnose at first. Over time, people may develop other symptoms that make it easier to make an accurate diagnosis. These symptoms include hallucinations, movement problems, and sleep disorders. Parkinson's disease dementia is another form of LBD. Parkinson's disease is a movement disorder that worsens over time. Some people with Parkinson's eventually start to experience changes in their cognition. This is called Parkinson's disease dementia. However, not everyone with Parkinson's will develop dementia. Seeking an accurate diagnosis early on is important. It can lead to more tailored treatments and help families understand and plan for a future with the disease. LBD cannot be prevented or cured, but changes to make the home safer, equipment to make everyday tasks easier, and social support are important. Additionally, medication, physical therapy, and counseling may help manage the symptoms for a period of time. People with LBD may also be able to join clinical studies where they can get support and learn more about the disease while helping scientists better understand how to prevent and treat LBD in the future. Scientists need people with LBD, their caregivers, and other healthy adults to volunteer for research. To learn more about LBD and participating in clinical research, visit alzheimers.gov/LBD.
Huntington's disease is a hereditary condition that leads to progressive degeneration of brain cells, affecting movement, cognition, and behavior. The disease is caused by a genetic mutation that is passed from parent to child. Understanding its genetic nature is crucial for family planning, early diagnosis, and management, allowing individuals and their families to plan for future care needs and explore treatment options to manage symptoms and improve quality of life. Compassionate dementia care focuses on person-centered approaches, prioritizing the individual's unique needs and preferences. Key practices include ongoing education for caregivers, effective communication, structured routines, respect for the person's dignity, and emotional support. By incorporating these strategies, caregivers can enhance the quality of life for those affected by dementia, promoting a sense of safety, comfort, and well-being throughout the progression of the disease. In summary, the Montessori approach to dementia care emphasizes preserving the individual's dignity and essence. By focusing on strengths rather than limitations, it enhances quality of life despite memory loss. The approach uses tailored activities and a supportive environment to foster independence, encourage engagement, and ensure individuals feel respected and valued throughout their care. Before we finish this module, let's go over a few questions to reinforce what you have learned today. These are general knowledge questions that we reviewed in this module. Feel free to go back in the module if you need a better understanding. For those seeking certification or CEUs, there will be questions of this nature asked in the post-test.
References for navigating the maze of dementia include a range of academic and professional sources, such as peer-reviewed journals, clinical guidelines, and books by experts in neurology and geriatric care. Reputable organizations like the Alzheimer's Association, National Institute on Aging, and World Health Organization also contribute valuable insights, providing a comprehensive foundation for understanding dementia and its management. Thank you for your time and attention.